Are you looking for stretches for your SI joint? If you're looking for stretches for your SI joint, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you about stretches for your SI joint, other strengthening exercises you can do for your SI joint, and other treatments that are helpful if you have SI joint pain. Now, if you find this video helpful, give it a like and subscribe to our channel. Make sure to hit the notification bell so you get notified of our future videos. Now, for people who don't know, your SI joint is an acronym for the sacroiliac joint. The sacrum is the bone that's right in the middle of your butt, basically. And on either side is the ilium, or the hip bones, the pelvic bones right here. So the sacroiliac joint is the joint between the sacrum and the ilium. It's really what forms the pelvic ring, that the two ilia join together in the front, and in the back they join with the sacrum to form the SI joints. Now, if you're looking for stretches for your SI joints because they feel stiff or stuck or locked up, probably it's a good idea to stop. That your SI joints are actually really supposed to be stiff joints. If they're mobile, that's a problem. So you really don't want to actually stretch your SI joints. Most SI joint pain actually comes from hypermobile joints. Now, a hypermobile joint in any part of your body, but also in the SI joint, can have the tendency to get stuck and be locked. And in that case, a manipulation to the SI joint is actually a really, really quick and effective treatment to get it back to its hypermobile state. But it is truly hypermobile and has the disposition to lock up again in the future. So don't further stretch out the SI joints. Now, we will go through some self-corrections and ways to unlock a stuck SI joint in this video, but you really don't want to stretch the SI joint itself per se. It's only supposed to have 1 to 3 millimeters of movement. Very, very little. It's kind of like an expansion joint. It helps to transfer loads from your lower body and your hip to your lower back, but it should only move a very tiny bit. And I can't emphasize that enough, that you don't really want to stretch your SI joint. So what stretches can you do to help SI joint pain? Well, again, the SI joint is an expansion joint. It's really just sort of a shock absorber to transmit forces between your upper and lower body. So if your lower back is too stiff or your hips too stiff, the SI joint has to stretch more or move more in order to make up for those other areas where you're not moving enough. And so if you have stiff muscles in your lower back or stiff muscles in your hip, then it causes your SI joint to become hypermobile, meaning moving too much. So stretches to stretch out your lower back. Some things that are really good to do that. My favorite one is the child's pose, where you get on all fours like this, and you sit back towards your heels like that, and that helps stretch out not only your hip joints, the muscles in the back of the hips, but it also stretches out the muscles in the lower back. And you can vary that. You can stretch the hip joints more with your back arched, or you can stretch the lower back more with your back rounded. But doing the child's pose is a really good exercise for people with SI joint problems. Now, the things that can cause your SI joints to get stuck or lock up are muscle imbalances on either side of the pelvis. So, for example, if one hip flexor is really stiff and the other hamstring is really stiff, it's going to twist or rotate your SI joints, not a ton, but just a little bit, a few degrees. And that can be enough to get them stuck or locked up or cause you some pain. So if that's an issue, then stretching your hip flexors can be helpful, and you can do that in standing, or you can do it kneeling, you can do it laying on a bed. I've got a whole other video on how to stretch your hip flexor muscles, and it shows you a few different ways to do that. So I'll refer you to that for more detail on how to stretch your hip flexors. But hip flexor stretches are really good stretches to do if you have SI joint pain. The other one is that if you have stiff hamstrings, and stiff hamstrings, most people think they have them, but a lot of people really don't. But if your hamstrings are really truly stiff, they attach to the butt bone and they can pull your SI joint backwards on the side that the hamstring is stiff. Now again, if both hamstrings are stiff, that's not as much of an issue as if you have a stiff hamstring on one side and a stiff hip flexor on the opposite side. It causes sort of a rotation along your pelvis. So muscle imbalances again. That's what causes SI joints to kind of get stuck or locked up. Now similar, you can have a side-to-side SI joint imbalance in your hip rotator muscles that attach to the sacrum. Your piriformis is the one that gets all the bad rap. And there are a lot of different ways to do piriformis stretches. You can do them sitting with your leg crossed and going down this way. That stretches one part of your hip rotator muscles. Or you can pull up towards the opposite shoulder, and that stretches a different part of the muscles. Now, how do you know which one's best for you? Really, the best option is to test it one way, test the other side, see which one's stiffer, and then pull up this way and pull up this way. And if you notice big side-to-side differences again, we're not looking for absolute motion necessarily, we're looking for a big difference from one side to the other. That difference is what tells you which side you really need to stretch. So those are a few simple stretches to help if you have SI joint pain. And again, they're not stretching the SI joint itself, they're stretching the muscles around the SI joint so that you don't have torsions or imbalances causing the SI joint to lock up. Now again, the SI joint's supposed to be stable. So how do you stabilize an SI joint? Well, you use the muscles around the joint to give it some external compression. There are a lot of ligaments that stabilize the SI joint, and usually those are the primary stabilizers of the joint. The bony anatomy of the joint and the ligaments usually do a pretty good job of compressing that joint and holding it together. But if you have loose ligaments, for example, from pregnancy, or you've had a fall on your butt, or you fell off from a high height and you landed on one leg and it sheared one SI joint up, any of those things can create hypermobilities in the SI joints. And so exercises to strengthen the muscles around the SI joints, particularly the glute muscles and the abdominal muscles and the lat muscles, the muscles back here. Those are some of the main stabilizing muscles of the SI joint. Your pelvic floor muscles, like doing Kegels, if you're familiar with those are also stabilizers of the SI joints. So how do you strengthen your abdominal muscles in order to help stabilize your SI joints? Well, it's not your sit-up muscles, your rectus abdominis or your six-pack muscles that you see at the gym. It's really the deeper abdominal muscles that help compress the SI joints together and help stabilize that. So you do that really just by pulling your belly in, trying to almost make like an internal corset. And that brings us really to the point of SI joint belts. Do they help? They create sort of that same compression mechanism on your SI joints, and they can really be very helpful if you have a hypermobile SI joint, particularly if you're pregnant and you have some hormones that are making your ligaments a little bit more stretchy in order to prepare for delivery. So an SI joint belt can be really helpful to create that compression, but you only want to use it at times when you're expecting the joint to hurt, or you're expecting to be on your feet for a long period, or you're expecting to do something else where it might put a lot of stress on the SI joints. If you're not expecting to do that, you don't want to wear it all the time because it weakens these internal stabilizers, your abdominal muscles that you're using or trying to train to do the job of stabilizing the SI joint on itself. Now, what other muscles can you use to stabilize the SI joints? Well, the global stabilizers, the things that work together, are your glute muscles and your lat muscle on the opposite side. So doing squats is a great exercise for SI joint pain. Lunges are a great glute exercise, but you have to be a little bit careful because it does put you into an asymmetrical position. So I wouldn't do that with a really irritable SI joint problem, but that is something that you can progress to down the road, and ultimately should progress to down the road to be able to use one leg at a time. But just starting out doing squats where you're evenly distributed and you're doing squats to strengthen both glute muscles at the same time is a good exercise to help stabilize the muscles around your SI joints. Now, at the same time, you also want to have strong lat muscles. The muscles that are kind of your wing muscles, they actually attach all the way down to the fascia in your lower back that attaches to the SI joints and helps keep it stable. So you don't want to neglect your upper body muscles because the SI joints, again, they transfer forces from the lower body to the upper body, and anything that spans over those joints, whether it be the lats or the glutes, can both help to stabilize the SI joints. Now, what other treatments are helpful for SI joints? We talked about stretches, we talked about exercises, we talked about SI joint belts. And the other thing that we briefly mentioned is manipulation. That spinal manipulation is a very helpful treatment for SI joint problems. For example, if you have stiff joints in your lower back, again, it's going to cause you to move more at the SI joint. If your hip joint is stiff, it causes you to move more at the SI joint. So manipulation to the actual ball and socket hip joint itself can be helpful for an SI joint problem. And sometimes if the SI joints, they do get stuck or locked up because they're hypermobile and one side's kind of gotten into a position where it's kinked, doing a manipulation to the SI joints can help very quickly relieve pain temporarily. But that pain will ultimately come back if you don't fix some of the causative factors that are causing the SI joint to go out of balance in the first place. Some of those are muscle imbalances. Some of those are things you do in your everyday life, just how you sit, how you stand. If you're in the habit of standing asymmetrically with more weight on one leg, or you tend to sit with one leg crossed over the other, or sit more on one hip than the other, those can all create muscle imbalances that again can cause SI joint problems. And those are all the things that we analyze when you come to our office at More for Life. Now, if you do need a manipulation to get something unlocked, we're really good at doing that too. But our goal is not to have you keep coming back over and over and over, week after week after week, to get your SI joint manipulated because it goes out. We don't want you to necessarily have to be reliant and dependent on us for pain relief for the rest of your life. We want to help you understand the root causes of it, that why your SI joint started hurting in the first place, and what you can do to keep it from becoming a recurrent problem down the road. Now, if that interests you and you're in St. Louis, give us a call at More for Life and we'll get you scheduled for an appointment and get you out of pain using manipulation or what other manual therapy tools we have to use to get you some quick pain relief, but also teach you the long-term solutions so that you can take care of it on your own. And if you're outside of St. Louis, but you found this video helpful, give it a like, subscribe to our channel, and turn on notifications so you get notified when we post our future videos. Thanks for listening and have a great day.